pneumonia, diarrhea, encephalitis, swelling of the brain which can be life-threatening or cause permanent brain damage, blindness rare but possible, especially in vitamin D deficient individuals. Transmission: measles spreads easily through respiratory droplets when an infected person coughs or sneezes. The virus can remain contagious on surfaces and in the air for up to 2 hours after an infected person leaves an area. The person with measles is contagious from about 4 days before to 4 days after the rash appears. Diagnosis of measles is typically based on the characteristic symptoms, especially the presence of coat-like spots and the typical rash. Blood tests or throat swabs may be used to confirm the diagnosis, particularly in outbreak settings or where vaccination records are unclear. Treatment: there is no specific antiviral treatment for measles. Management focuses on relieving symptoms and preventing complications. Rest and hydration: plenty of fluids and bed rest are essential. Fever reducers: paracetamol, acetaminophen or ibuprofen can help lower fever and relieve discomfort. Vitamin D supplementation: this can reduce the severity of the disease, especially in malnourished children or those with vitamin D deficiency. Treatment of complications: antibiotics may be needed for secondary bacterial infections like pneumonia or ear infections. Prevention: vaccination: the most effective way to prevent measles is through vaccination. The measles vaccine is typically given as part of the MMR measles, mumps, and rubella vaccine, usually administered in 2 doses. The first dose is given at 12 to 15 months of age. The second dose is given at 4 to 6 years of age. Vaccination is highly effective, with 2 doses providing around 97% protection. Isolation: in the case of an outbreak or if someone is infected, isolation is crucial to prevent spreading the virus to others. Infected individuals should avoid contact with others, particularly those who are unvaccinated or have weakened immune systems. Post-exposure prophylaxis: if someone has been exposed to measles, receiving the measles vaccine within 72 hours or immune globulin for those who cannot receive the vaccine within 6 days of exposure can help prevent the disease or lessen its severity. When to seek medical help: high fever that persists or worsens, difficulty breathing or persistent cough, signs of complications, such as ear pain or confusion. If you suspect that you or your child has been exposed to measles, particularly in areas with recent outbreaks or in individuals who are unvaccinated. Conclusion: measles is a serious illness that can lead to complications, especially in vulnerable populations. Vaccination is key to preventing the disease, and early recognition of symptoms can help manage the illness effectively and prevent further spread.